Tangible ways to keep our hearts healthy and strong. And I think for a lot of people, most people don't know what their blood pressure is until they go in for a physical.
That's right.
If they go in for a physical.
They go in for a physical, which is why it's important to see a healthcare provider at least once a year. It is the silent killer. Why do we call it that? Because you don't know you have high blood pressure until it starts to hurt you, which is often at the time of a heart attack or a stroke, which is why it's important to check your blood pressure. Because as we age, our blood vessels start to lose compliance. So let's talk for just a quick second about why high blood pressure is bad.
Okay.
Our blood vessels are supposed to expand and contract. They have muscles in them, and our heart pumps into those blood vessels, right? But if blood vessels start to narrow or become rigid, the pressure in those vessels becomes higher, and then the heart has to work harder. So those muscles in the heart that are now pushing against more pressure over and over again can start to give way. And so when we talk about reducing cholesterol can make those blood vessels hard.
Right.
We talk about eating fruits and vegetables. That gives us antioxidants that softens the blood vessels and clears some of that buildup in plaque. So it's these things have a purpose. If we know why we're doing it, maybe we're more likely to do it.
Well, that's definitely true.
We have this at the house. This is just a regular portable blood pressure cuff. It's got powered by batteries. The cardiologists like the blood pressure monitors that go on the upper arm rather than the wrist. Something's better than nothing. So if you have one that goes on your wrist, then at least you're doing something. But better to have one on the upper arm, and better to actually measure your arm and make sure that it's the right size.
That's why I was confused. I bought one and I was like, this is not right. And I can't make it tight enough, so I had to return it.
Yeah, you have to get one that's your right size. And so that's going to give you the more accurate result. You guys know what high blood pressure is?
I did not. And I was surprised. She's like, it's a little high. I don't like that. So I was like, well, I thought that was perfect.
It used to be 140 over 90.
Okay.
Used to be. Now 130 over 80 is considered high.
Okay.
What?
130 over 80 is considered high. And again, you think about long-term work of your heart.
Yeah.
Your heart does not want to push against that. Even that slight incremental high blood pressure is going to make your heart work harder.
Yeah.
Okay.
And it's also important to exercise, because exercise builds up the muscles of our heart. It helps us soften those blood vessels, and it helps us to kind of not deal with later, heart failure and things like that.
Oh, you got a rap for us?
Yes, I do.
All
Cue
right.
my music. Systolic, the other one's diastolic. Both are silent, meaning they are diabolic. 140 over 90 was the definition. Now 130 over 80 is the new villain. We fight back. Check your pressure is one way to take back. Power over your health is your heart check. The silent killer's trying to sneak attack, but we fight back. That's it. You did it.
All right.
Awesome. Dr.
Okay.
Wendy, thank
130
you.
over 80.
130 over 80.